We offer a wide variety of dental technology here at Bright Star Dental for our patients because we want to give them the best care that we can that's available today. One of the first technologies that we use that comes to mind is our machine called CEREC. And what it is, it allows us to fabricate crowns and bridges right here in our office with a very, very strong material called Emax. What we would do, for example, let's say a patient needed a crown in this area and we'd shape the tooth for the crown already. Rather than taking kind of an old-fashioned gooey impression, we actually just use a little camera that's like a little wand, and we take a video of that tooth. Once that video is taken, we send that to our computer, and we actually design the crown right on our computer. And then we send that to our milling machine, and right here in the office, it mills the crown out of a solid block of the CEREC material, of the Emax material. The Emax material is like a zirconia, like a artificial diamond, very, very strong, very, very hard, very, very accurate, and allows us to make really a custom-made crown designed in effect in the patient's mouth right in our office within an hour. It's wonderful for our patients. We can also do the same thing with bridges. One of the other things that we use at our office are what we call digital x-rays. In fact, we were the first office in New Mexico to have digital x-rays, and what that does is uses digital technology to take the x-rays in our mouth, exposing a patient to far less radiation, 1/20th or less of the radiation of a regular x-ray, with much more accuracy. We can look at very enlarged pictures of a tooth or a bone area. It allows us to catch decay or gum disease or bone issues very, very early, much smaller than we would have when we had the old x-rays. So we can do a much more conservative procedure or treatment to help the person get back to good health. Patients really like it too because they're fast and they're comfortable, not like the old-fashioned ones. Another technology that we use is we use an intraoral camera. It's basically like a little wand, like we discussed with our CEREC machine, but it allows us to actually kind of go through the mouth and take a tour, checking out all the surfaces, looking at soft tissues, the gums, the cheek, the lips, the tongue, and hard tissues, the teeth, to see if there are any issues. It lets us confirm things that are good. For example, we put a crown on and we want to check that margin, we can use our little digital camera to look at that, our intraoral camera, to make sure it's just right. Or we can also look and maybe we would find an area where there was a cavity or a gum problem. Again, catching it maybe early so that we can give good care to our patients. One of the technologies that our hygiene department uses when they're doing gum therapy is what we call an ultrasonic scaler. And that allows them to, when a patient is comfortably numb, allows them to go down below the gum with an instrument that's very rounded at the tip. It's not sharp or anything like that. And that round tip just touches the tartar, and when it does, the tartar just falls off the tooth. It also is very gentle on the root surface. The older, old-fashioned type of scaling instruments that many hygienists still use in their offices can cause damage to the root surface of a tooth, almost like nicks or damage to a piece of wood. We don't want that to happen. So the ultrasonic scaler allows us to go into those areas and not cause any damage, allowing for the gum to heal back, really giving a better result to our patients. Any of the technologies that we use and all of the technologies that we use in our office, I think we've chosen not just because of the scientific basis for them, although that's very important, but because we are trying to achieve the best end goal for the patient. And I would say it's regardless of a patient's age or anything about them. We want to give them the best care their whole life and the best dental care that they can have so that they can function well, chew well, speak well, smile well, and have very good dental health for the rest of their life.